Here I am recovering, getting out of here finally tomorrow. Am I going to get a vaccine? No.
Even though COVID-19 cases are back on the rise in the U.S., that apparently has not fazed some anti-vaxxers, including ones that are literally in a hospital bed with COVID-19. So I'm going to have two clips here. The first one that I'll show you is this guy that apparently is unfazed by having COVID-19 and thinks that the vaccine's still scary. And I'll show you later on someone else who has now woken up to the reality that she should have got the vaccine to begin with. But first, here is this incredible clip from Louisiana where cases are dramatically increasing.
This week, the state's health department reported the highest number of COVID-19 hospitalizations since late February. Scott Rowe is one of them.
Here I am recovering, getting out of here finally tomorrow. Am I going to get a vaccine? No.
Why not?
Because there's too many issues with these vaccines.
This father, former baseball coach, small business owner, and hunter, caught COVID and then he developed pneumonia.
Before you got sick, if you would have had a chance to get the vaccine and prevent this, would you have taken the vaccine?
Nope.
So you'd have gone through this?
I'd have gone through this, yes, sir. Don't shove it down my throat. That's what's local, state, federal administration is trying to do. To shove it down your throat.
What are they shoving? The science?
No, they're shoving the fact that that's their agenda. The agenda is to get you vaccinated.
You know who Mr. Scalise is?
I know who Steve Scalise is very well.
Rowe, who is a Republican, had not heard that Steve Scalise, the second-ranking House Republican in Congress, had stepped into the forefront yesterday as a vaccine proponent. We asked him to read the congressman's statement.
He thinks that it's safe and effective.
And what's your reaction?
Not proven.
But does his opinion change yours?
No, it does not.
This is just remarkable. I'm going to try really hard here not to just sound like an asshole, because I really don't understand how anybody can be this stupid. I don't get it. He keeps saying, don't shove it down my throat. Yet you're perfectly okay with literally shoving a breathing tube down your throat because you can't breathe from COVID-19. That's perfectly fine. But don't suggest I get the vaccine, even though it's saving lives. I mean, we see these headlines over and over again. The data bears this out. 99.8% of Los Angeles COVID deaths in past 6 months were among unvaccinated people. And this stat is across the board. People getting COVID-19, 97% plus of them are unvaccinated. Yet, this reality does not matter at all. They'll go to the hospital, have a breathing tube shoved down their throat, take medication from the hospital to get better. That medication's fine, but they won't take a vaccine. It's completely deranged, and I'm speechless. It doesn't make any sense whatsoever. And Steve Scalise, as was mentioned there, Republican minority whip, finally came out, got the vaccine, citing the Delta variant. But I guess doesn't matter for these people. Just completely delusional. Now, let me get to somebody who did change their mind. So CBS also interviewed someone else who got COVID-19 and now realizes that, yeah, she should have got vaccinated.
I honest to God thought I walked my last day on this earth. I could not breathe. All of a sudden, my lungs just didn't work.
Paula Johnson was rushed here by ambulance.
I have no comorbidities, nothing, never had a lung problem, don't smoke, nothing. And it took my lungs and just, whew, I don't even know how to explain it. It's like trying to breathe in and hitting a wall in like a second.
Johnson is a pharmaceutical researcher who put off getting the COVID vaccine, but now she wants it.
I'd say get the vaccine. Take the chance. It can't hurt. All it can do is alleviate some of the symptoms, even if it doesn't keep you from getting it.
All right, so this clip is important for a couple of reasons. First, of course, here's somebody who changed their mind on the vaccine, but also because this is a pharmaceutical researcher. There is a lot of skepticism, even from some in the healthcare industry, of the vaccine. And that's, I think, largely because they understand the power of Big Pharma. They think because they've pushed other medications onto people that also applies here in this situation. So, for example, the way that painkillers have been pushed onto people and the kind of destruction that's caused, they apply that same thinking to the vaccine. But you have to be able to separate fact from fiction. Yes, we can acknowledge the way that painkillers or other medications have been pushed onto people and trying to solve every issue with the pill is a bad thing. At the same time, you also have to see the actual science and data and results when it comes to vaccines. So you can't compare the two. This is a very different situation. When you have 98% of people that are ending up in the hospital, or 97% plus people ending up in the hospital unvaccinated, it is very clear what is going on here. To still deny that reality is to just be completely delusional. Now, some may wonder, why even care? If these people want to not get vaccinated, then fine. Let them not get vaccinated. Let them get COVID-19 and die. Well, part of it is I actually care about people, regardless of how stupid you are. But even apart from that, kids under 12 right now can't get vaccinated. I have a kid under 12. I have to worry now every time he goes out in public that somebody around him, whether it's in a restaurant or a sporting event, whatever it is, that he may get COVID-19 from someone else that's not vaccinated. Like, that's the issue here. So there are still people in the population, kids that are at risk from COVID-19 who can't get the vaccine. The more people that get vaccinated, the less of a risk there is to those children. So that's why I still care about this issue. And just on the unvaccinated part of this, there's many stories now about unvaccinated hospitalized patients say they regret not getting the shot. So you see this quite often. Here's one from Alabama. So from a doctor here saying, I'm admitting young, healthy people to the hospital with very serious COVID infections, wrote Cobia, a hospitalist at Grandview Medical Center in Birmingham, in an emotional Facebook post Sunday. Quote, one of the last things they do before they're intubated is beg me for the vaccine. I hold their hand and tell them that I'm sorry, but it's too late. This is just devastating. People realizing on their deathbed that they made a mistake. Don't be one of these people.